Alright, so my name is Morgan and I'm an instructor with Rocky Mountain Adventure Medicine, and just because we're instructors does not make us immune to injuries or foul-ups such as blisters. So as you can see here, I've got a pretty gnarly blister, or what's left of a blister, due to a series of misfortunate events, and my goal is to actually get back on the trail next weekend, well, 2 days away. So we're going to try a new treatment today using Mepital. You may have seen a great blog post by our other instructor, Alana, on the product, and we're going to show you how to use it. So first thing you want to do is clean the wound really well with soap and water. You don't want to use things like alcohols because it's going to damage the healthy cells and delay the healing process. So just use soap and water to clean it out. You can see where the wound itself is pretty clean. We got a little bit of glue around the outside, but that's alright. The next thing we're going to do is we're actually going to cut a piece of Mepital to be about approximately a little bit bigger than the wound site itself. So here we go. There we go. Next step we're going. So the next step here is we're going to apply the Mepital to the skin. So it's a silicone product and it's got plastic sleeves on each side. So you want to remove one side of the sleeve, and then you can carefully place it over the wounded area, flatten it down, and then you can gently remove the backing off the other side. So now you can see it's in place. Alright, so the next step is we're actually going to put an absorbent dressing in there. So the Mepital itself acts as a perfect layer for next to the skin. However, it's not absorbent. So you've got some holes in there which are going to allow for drainage. And what we're going to do is we're just going to cut a non-adherent antimicrobial dressing just to go over the Mepital. So that'll do just like that, and we'll place it as a second layer. Alright, so the final step is to secure this dressing in place. So to do that, I'm going to use Leukotape, and you can tape it any way you would, just like you would perhaps tape an ankle normally to stabilize it. So the first thing I'm actually going to do is I'm going to put a piece of tape underneath my ankle to act as a bit of an anchor point. So that's just going to go underneath the arch of my foot. So be sure when you do this that you've got your foot in a nice relaxed position, that it's not too tight and it's not cutting off any circulation. Then you can basically put overlapping strips of tape and secure them to the anchor tape itself. First one there. I'm going to try to keep your foot relaxed and not to apply the tape too tight. If it's too tight, it's going to cut off the circulation. I'm going to put a final piece of tape actually around the instep again, just to kind of lock everything in place. There we go. Perfect. So, key points to remember, you can definitely take the dressing off to evaluate the wound site. Things you might want to consider is to change the non-adherent absorbent dressing out. But remember, you can actually keep that piece of Mepital up to 14 days. So you leave that against the skin and just release the other layers. Anyway, I hope this works out for you guys and it brings you some comfort and peace on the trail.